Hello students, today we are going to discuss a topic that is breast self-examination, that is also called as BSE. Now this breast self-examination is very important and each and every female should know what is this self-breast examination and what is the importance of this self-breast examination and why it should be done. So this BSE is breast self-examination, and this breast self-examination means the examination of the breast which is done by the person himself. The female, she herself checks her breast for presence of any lump or whether there are any changes in the shape of the breast, size of the breast, or there is any change in the axilla, that is armpit, or also called as underarm. And this examination will help her to know whether she is having any malignancy of the breast, that is cancer of the breast. And this self-breast examination will help in early detection of cancers, because a person herself will know her body very nicely and she can find out whether there are any changes in her breast. Now the question arises that when should this breast self-examination is to be done? So this breast self-examination should be done by all women who are 20 years or older. They can perform this self-breast examination on a monthly basis. Usually this should be done at the end of the menses, that is 4 or 5 days after menses. Whereas if the female is in her menopause or who has attained menopause, this breast examination can be done on monthly basis, and usually it's better that she can remember that day. Like if she is doing in the first week of Monday, so every month she can do this examination on the same day so that she can remember, yeah, I have done my examination in this month. Now in the next month also she can mark it on the calendar and she can do her breast examination. Now, what are the advantages of this breast self-examination? This self-breast examination will help a woman to assess her breast. By doing this examination, she can check out the changes which are occurring in the breast, and if she sees any changes, she can consult her doctor, and this will help in detection of early cancers. Cancer can be detected at a very early stage if a woman regularly performs self-breast examination. And the main advantage of this is a very simple procedure. It is a non-invasive procedure. It does not require any technical knowledge. Even a woman who has not been educated or who is not having any professional degree or something, she's just a school pass also, she can also easily understand this technique and she can perform self-breast examination. While doing self-breast examination, she has to see for the changes in the shape and size of her breast. Routinely, there is a slight difference in the shape and size of both the breast. Usually, left breast is slightly bigger than the right breast, but only a slight difference is there, not a major difference. Then she has to look for presence of any lump, whether she can palpate any lump, whether there is any puckering of the skin of the breast, whether there is any discharge from the nipple or areola, and whether there is any presence of any mass in the axilla. So she has to see for these changes. There are some disadvantages also of this self-breast examination, because whenever a female is doing self-breast examination, she usually faces some anxiety and fear. She's worried that I'll be doing self-breast examination. What will happen if I find any lump, whether it is malignant or not? Because Every breast lump is not a malignant condition. At times, there are benign breast tumors also which are present in the breast. So there is no need to panic. Now we'll see the steps that how you can perform self breast examination. For self breast examination, the first point is inspection. Inspection means you are just observing whatever abnormal you are finding. Here you have to compare both the breast, and second is palpation. Palpation means you have to touch and feel that area for any changes. Inspection can be carried out before standing a mirror. It requires a sufficient big mirror so that both the breast can be easily seen in the mirror. And palpation, this examination can be carried out in lying down position, in standing position, or in sitting position. So one by one we'll see the points. So the first one, that is inspection. So these are few photographs how you can do inspection of your breast standing in front of the mirror. This inspection can be carried out with your arms at the side as shown in this first picture. You are keeping your arms by the side of your body and you are looking for the breast in the mirror with the hands on your hips, and thirdly with your arms raised above. So these are the three ways in which you can do inspection. And here if there is any lump, that can be seen. If there is presence of any lump, if there is any swelling in the axilla, that also can be easily seen. Now coming on to palpation. Once you have completed with inspection, then you can go for palpation. This palpation is carried out with the flat of your fingers. You have to join all your four fingers, and with the flat of the fingers, you have to feel the breast. Don't pinch the breast in between your fingers. That is a wrong method, because by pinching the breast, at times you will feel that there are nodules in the breast. Actually, they are not nodules, but the breast is a fibromuscular tissue is present in the breast, and it is a fibroglandular tissue. So because of that, you can feel at times that there are small lumps in the breast. So don't pinch the breast, but with the flat of your fingers, you can do palpation. And every time when you are doing palpation, it should be done of the both the breast. Now this palpation can be done in either you can go in a circular pattern as shown in this figure, starting from the nipple. Around the nipple, you'll move your fingers and then you'll reach the periphery of the breast, or it can be done in up and down fashion, or it can be done in wedge pattern also. And this you have to do, as I told you previously, every month. And whenever you are repeating the breast examination, it should be done out in the same method by which you have done in the first month. Like if you have gone for a circular pattern, you should follow that same pattern every time. Don't change your pattern. Now coming on to palpation of nipple and areola. Once you have finished the palpation of the breast tissue, then you palpate the nipple and areola, and you gently squeeze the nipple so that if there is any discharge from the nipple, you should consult your doctor immediately. Third is by lying down position. You can do breast examination in lying down position also. In lying down position, you keep a pillow under your right breast and you put your right hand behind your head, and with the left hand you palpate the right breast, and similarly you can repeat this for the left breast also. Now what's normal? What are the normal findings? See, breast is usually firm when you palpate the breast, and there should be no lumps, no areas of warmth and no areas of tenderness. These are the normal findings. There should be no discharge from the nipple. Axilla should be smooth and there should be no palpable nodes in the axilla. Many times when a woman finds a bit change in her breast, she gets panicked. But it's not always a reason to get panic, because many times there are slight changes in your breast at the time of menses, and even as your age advances, there are some changes in your breast according to your age. So now a question arises that when you should consult your doctor, because every month you're doing your breast examination, and every time you note down whether you are getting any changes or not. So when to consult a doctor? If you palpate any lump in your breast, or if you palpate any nodular structure or a knotty feeling in the underarms. So at that time you should consult your doctor. If you see that there are any changes in the nipple or areola, if there is any puckering of the skin of the breast, or if there is inverted nipple, if the nipple gets retracted, or if there is any warmth or swelling or pain in the breast, if there is any bloody discharge from the nipple, at that time you should consult your doctor. And then according to your condition, the doctor will advise you some further test that will help you to confirm your diagnosis. Thank you.